In today's Eye on Health, a new treatment option is improving lung functions for patients with severe COPD or emphysema. It's become a viable alternative to major surgery, and it's increasing exercise capacity and quality of life.
Only a small number of doctors in Pennsylvania are offering this life-changing procedure, and one of the doctors is joining us right now, Dr. Sohini Ghosh, along with Robert Schreiner, a patient who has COPD and asthma as well. So, Bob, we want to talk to you first, and you were telling us before what a difference this has made for you. Talk to us about what that means.
Well, growing up in, when I was in school, I ran track, pole vaulted,
right,
440,
wow,
stuff like that. And, I had a brain cramp and I started smoking cigarettes. And that was, if anybody's out there smoking, quit.
Right. That changed your life.
It did. And, through the process of, growing up and working different places and everything, I could tell that I wasn't able to do the things I used to do.
Right.
Yeah.
And back in several years ago, I developed RSV infection.
Mm-hmm.
And I really went downhill from there. And, and I could barely walk across the room without being out of breath. If somebody came to the door, I had to put my oxygen on to go to the door to answer the door. Now, I'm walking a mile a day.
No kidding.
No kidding. I take my oxygen with me because you never know.
Right.
You got to be careful.
Well, that must be a big change, though, because,
Yes.
obviously you had struggled with this for many years. And Doctor, I wanted to ask you, though, for those that aren't familiar, what exactly is COPD and how is it treated?
Yeah, so COPD is a disease of the lungs which essentially causes hyper or too much air, hyperinflation that gets stuck in the lungs. And there's a lot of causes from it. Number one is smoking, environmental exposures, occupational exposures, as well as sometimes genetics. The main two classes of therapy right now are drug therapy, so primarily inhalers, which are limited, as well as pulmonary rehabilitation. On the other spectrum, there are some more extreme treatments like lung transplant and things like that. And so this procedure allows for a kind of minimally invasive option for patients who are candidates for it.
So let's talk about that, because that's what we want to get to.
Yeah.
We want to talk about these valves, and they're essentially, Robert has several of them, but they're valves that can help oxygen get out of the lung.
So they actually find, when we first identify what is the most diseased part of the lung, so there's essentially 4 lobes or so in the lung, we identify which is that most diseased, where all this extra air is getting stuck in the lung. And when that air gets stuck in the lung, it's essentially too big for the thoracic cavity, and the diaphragm and the other muscles that help you breathe aren't working normally. Once we identify what is the most diseased portion, we can do a procedure under general anesthesia, where we can put these valves in through what's called a bronchoscope or camera into the lungs. We put them into that most diseased part of the lung, and they're one-way valves that kind of cause that part of the lung to shrink so that the healthier part of the lung can do more of the breathing, and then it takes some of that extra pressure off of the muscles so patients can breathe better.
Wow. And obviously, Robert, you have a whole new quality of life now as a result of this procedure.
Oh my gosh, yes. Yes.
Yeah. Like you said, you walk a mile a day, and anything else that you've noticed that has improved?
Steps, going up and down steps. I used to go about 5 steps and I would stop.
Yeah.
Do 5 more steps and think, I got 3 more.
Wow.
Now it's
Yeah. That's
up and down.
fantastic.
Yeah.
Bob, we're so happy for you. And again, this is called the Zephyr valve. It's about the size of your thumbnail, and you can do the procedure by just going down the patient's mouth.
Exactly. No cutting of the skin, no surgery, nothing like that.
Right. Thank you, doctor, for
Thank you
joining
very
us as well
much.
to explain this. Really fascinating, and I think so many people are affected by this. This could help a lot of people.
Absolutely.
Yeah, absolutely. Thank you again both
Thank you.
so much. And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.